So nearly 3.5 million South Africans have had at least one vaccine dose. But there are plenty more still waiting for their potentially life-saving COVID-19 shot. So far, health workers, the over 60s, teachers, the over 50s and police have been lining up. And most of us happy to wait our turn, but some concern about a circular issued on Sunday suggesting that politicians, ministers, deputy ministers, premiers, MECs and their staff will be vaccinated now. That notice has now been withdrawn, but it raises an important point of fairness on how we proceed. And I'm joined now by Fatima Hassan, founder and director of the Health Justice Initiative. Thank you so much for your time. Now, the circular, it's been withdrawn because there was quite an outcry, but you were very concerned, and you've also said we need to keep watch on this particular space and be ready. Why do you say that?
Thanks, Sally. So I think two reasons. One is that the acting minister has indicated that the circular didn't have the approval of what she calls the Interministerial Committee on Vaccines, which presumably refers to the National Coronavirus Command Council, but we're not sure. But the Deputy DG indicated in the withdrawal notice that it was withdrawn because of a number of commented submissions and because and I quote, the intentions of the circular were not clear. So the reason why we are concerned is that we don't want it to be necessarily redrafted with a clearer set of intentions where you still prioritize people that don't warrant special treatment to get to the front of the queue. And this is why we are very concerned that many organizations, as well as the media and the public, have to keep a really close, watchful eye on how prioritization decisions are being taken, but also then being communicated to the public.
On the other hand, there's been quite a lot of talk that sometimes high-profile people, and that would include politicians, should be vaccinated and vaccinated in public to show people who are believing the conspiracy theories, either that COVID doesn't exist or that it doesn't really kill more people than flu or that vaccines are bad, all of which is rubbish, but to show people that the vaccine is crucial. Don't you think that's perhaps something to consider?
So that should have been considered months ago as part of an anti-vaccine hesitancy program, but it's certainly not the reasons why this particular circular was drafted. The circular was drafted with particular special groups in mind, with no public health prioritization, defense or justification or rationale. So if you want to deal with vaccine hesitancy, I think you can develop a national program that can address that. It may not be the most appropriate thing, in the first week of July to start vaccinating some of the ministers who fall outside of the current eligibility criteria, to use that as a basis to encourage more people to get vaccines. If anything, what we saw in the response on social media today was that people were really outraged. The public wants equity and the public wants fairness, and everybody, who can wait their turn should wait their turn, so that people who are most at risk and people who are living with comorbidities need to be at the front of the queue.
Originally comorbidities was meant to be with the second group, which is, in other words, essential workers, comorbidities, the over 60s. And my understanding from what the health department said is that they simply don't have the records so that they can check that people who say they've got comorbidities have got comorbidities. So essentially what they have to rely on is your ID number, which says when you were born, which is why we're going age-related. Do you think that's a bit of an indictment on our health system, our public health system?
Definitely. If the private sector knows full well the cohort of populations that uses the private health sector, where they have members who are under 60 or under 50 years with comorbidities, I really don't know why the public health system doesn't have this data. There are ways in which other countries have tried to address that by, for example, focusing on ARV clinics or TB clinics or cancer treatment sites. So there's definitely ways in which you could, with information, with evidence, verify that somebody who's claiming that they have a comorbidity does indeed have one, because they would have a patient profile, they would have a medicine profile. If you're willing to create a system with a special form for special authorization for all of those groups that were included in the circular that was issued on the 4th of July, including 4 ministers and deputy ministers, why can't you create a system like that for people currently under 50 years old with comorbidities, where they can also similarly submit a form and ask for an exemption? The issue, of course, is whether you have enough supplies to be able to do that. And that is why that, again, requires government to take greater steps and to exert more pressure pressure on the pharmaceutical companies, because the situation we're in right now is that we don't have 40 million supplies of vaccines where we all can just get to the front of the queue and have mass vaccination, happening within weeks. Because we have limited supplies, we're all arguing, we're all fighting with each other, and it's causing so much social incohesion. And when you have a government that then issues a circular and then withdraws it 48 hours later, on grounds that are not really clear to us, to prioritize certain groups. If you look at some of the categories in that circular, that really is for us a worry. How are these prioritization decisions being taken? Whose expert advice is being relied on? And what is the role of the MAC Vaccine Advisory Committee in relation not just to this circular, but other decisions that have been taken in the last few weeks as well?
Thank you so much for your time, Fatima Hassan, founder and director of the Health Justice Initiative.